Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le...
Good morning and welcome to the update. Les personnes suivantes.
Chief Medical Officer of Health and the Honorable Blaine Higgs, Premier of New Brunswick. Les personnes suivantes prendront la parole lors de la...
The following people will speak in the information session. Dr. Jennifer and the Premier of New Brunswick, the Honorable Blaine Higgs. Dr. Russell. Merci, Bruce. Today, I will speak about the following issues: Zone 5 outbreak status, Parkland St. John update, our management of the pandemic in southern and western New Brunswick, and how to plan a happy and safe holiday season in this time of COVID-19.
The Zone 5 outbreak status, Parkland St. John update, our management of the pandemic in southern and western New Brunswick, and the definition of our triggers, and how everyone can plan for a happy and safe holiday season in this time of COVID-19. L'éclosion de la COVID-19 qui s'était déclenchée dans la zone 5 est officiellement terminée. La zone 5, soit la région de Campbellton-Restigouche, était passée à la phase orange au début du mois.
And Zone 5 in Campbellton transitioned to orange level in early October following an upsurge of cases during the neighboring Gaspé region. Through cooperation and support of people in the Campbellton region, we were able to slow the spread of COVID-19 and move the area back to the yellow level on November 5th.
The Zone 5 COVID-19 outbreak that began on October 9th is officially over. Through the cooperation and support of the people of the Campbellton region, we were able to slow the spread of COVID-19 and move the entire area back to the yellow level on November 5th. Since then, Public Health has monitored the situation through two 14-day incubation cycles. And we are now confident that the outbreak is over and existing measures are sufficient to maintain the area's yellow level status. And I would really, really like to thank everyone in the Campbellton-Restigouche region for their commitment, their patience, and vigilance in slowing the spread of the virus. It really was a collective effort. And everyone who self-isolated when directed, who avoided large gatherings, they wore masks and maintained physical distance, and it really did make it possible for us to limit the impact of this outbreak and bring it under control quickly. So, les dirigeants à l'échelle locale ont également joué un
The local leadership was also instrumental in informing updates on orange alert requirements, and
really, it allowed us to learn from that outbreak and that situation. All the learnings that we took away from that, I feel very positive about. And I want to thank that all the leadership, the media outlets, et cetera, who really did work collectively to allow us to take that opportunity and learn from it for the other outbreaks that we are seeing now. Another round of testing of Parkland St. John residents and employees was recently completed. The results are as follows. All the residents tested negative. One employee who has been off work and isolating for 9 days tested positive. And I can tell you that another round of testing will occur at the independent living section tomorrow and the nursing home next Tuesday. Therefore, to date, there are 16 confirmed cases at Parkland St. John, 6 employees and 10 residents. The other day, I acknowledged the excellent collaboration between Parkland St. John and the extramural program folks and the Ambulance New Brunswick folks, who are the members of the prompt team, who have been on site to ensure testing and support and infection prevention measures, along with working with the public health team. But I would also like to give a shout out to all the other players that I inadvertently missed, including the social workers. So thank you for all of your hard work. De nouveaux cas de COVID-19 continuent d'être significatifs.
We are continuing to see new cases of COVID-19 across New Brunswick. This is a reality that we will have to manage until our allotment of available Health Canada approved vaccines are widely available. I think the message we're receiving is that within 1 year, we hope that the population in New Brunswick, at least 75%, will have been vaccinated.
Covering most of southern and western New Brunswick, our three largest cities, and the majority of our province's population remain at the orange level. And while we are seeing some progress, again, which means that people are following public health advice and measures and recommendations, these zones will remain in orange while we evaluate the effectiveness of the public health measures announced last month. So it usually is a 2-week time frame that we put the restrictions in, and then we assess. And so that's how we're approaching these zones in the orange level right now. And as we make those assessments, there are a lot of moving pieces involved when making a color alert decision, and I know that there is confusion around the triggers that we have online. So I just wanted to clarify for anybody wondering that this document is what triggers us to conduct a risk assessment. And although the risk assessment may lead to a decision to change a zone's color alert, the triggers themselves are not the risk assessment and should not be viewed as such. So, for instance, the decision to move to Zone 3 to orange was based on the region meeting the following triggers. There was a confirmed case in a high vulnerability setting, such as the Dan Cassidy Centre. There was also another vulnerable setting there as well. Noted low compliance to public health measures in Zone 3. We had information from Department of Public Safety around the compliance from mask wearing, so that was part of our risk assessment. And because of the backlog that we experienced in some zones, the health system wasn't able to screen and test at the required number of symptomatic patients in a timely manner. And I can tell you that Public Health will be conducting another risk assessment this Sunday to assess Zones 1 and Zones 3. Aujourd'hui, Santé publique confirme.
Today, Public Health confirms there are 6 new cases of COVID in New Brunswick, one in Zone 1, Moncton, southeast New Brunswick, and an individual aged 30 to 39, and there are 3 cases in Zone 2, St. John region, one individual under the age of 19, one between 30 and 39, and one between 60 and 69. In Zone 7, there are 2 cases, Fredericton area, person between 60 and 69. There are presently 101 active cases of COVID-19 in New Brunswick with no individuals in hospital. I ask you to keep all these cases in your thoughts and prayers today.
Public Health has confirmed 6 new cases of COVID-19 in New Brunswick. In Zone 1, which is the Moncton and Southeast New Brunswick region, there is 1 case, an individual aged 30 to 39 years of age. In Zone 2, which is the St. John region, there are 3 cases, 1 individual under 19 years of age, 1 individual 30 to 39, 1 individual 60 to 69. In Zone 3, the Fredericton region, there are 2 cases, 2 people between the ages of 60 to 69. There are currently 111 active cases of COVID-19 in New Brunswick, with no individuals in hospital. And my understanding is the last count, there were about 1,500 people in self-isolation. So I ask you to keep all of these people in your thoughts and your prayers today. And we've all been thinking about the holidays lately, and we really feel that this holiday season will be different by necessity. Given the surge of COVID-19 across North America and around the world, this isn't really the year to be able to spend holidays in an exotic location. Ce n'est pas non plus l'année.
It's not the year to travel outside the province to visit family or to invite family members who live away to come home for the holidays. It can still be a joyous occasion filled with light and love and yet safe for all. It can be this way if we plan it this way. Si on commence
This holiday season, I feel that we can be successful. We're just putting out some new information online about our advice around celebrating the holidays. And I would ask that you focus on what you can do rather than missing out on what you can't. I can tell you that the medical officers of health in New Brunswick right now, again, are working very hard to keep the outbreaks that are in existence out of control right now. And certainly, the hope is that they are under control and we can have a safe holiday season. But we wouldn't want that holiday season to result in outbreaks and super spreader events that then put us back in January, where we would not be able to see schools stay open and businesses stay open. So that's why we are trying to give good positive messaging around what to do safely during the holiday season that doesn't jeopardize having schools and businesses open in January. So we want to strive to keep everyone safe and healthy by protecting yourselves and those around you. Start by keeping your gatherings small, and I cannot emphasize this enough. Keep your circle of contacts consistent and small, no matter where you live in New Brunswick. I don't think there's any outbreak up to this point in time that hasn't involved large number of close contacts. And so this is the marching call, the call to action for everyone this holiday season. Keep your number of close contacts extremely small and consistent. Il y a moins de restrictions s'appliquent.
There are less restrictions for yellow levels, but I recommend that everyone limit their close contacts as much as possible.
When people were within 2 meters of an infected person without wearing a mask. And so what we know is that masks are very important. They are one of the several measures of protection, layers of protection that include social distancing, hand washing, border measures, proper self-isolation, getting tested when you have symptoms, keeping your number of close contacts small. So it is one of many things. It doesn't work alone by itself. It has to be accompanied with all of the other measures to prevent the spread of COVID-19. So overall, we really are just focusing on what we know about the transmission patterns that we've seen and what we can do to prevent them. So now more than ever, we need to maintain these practices that slow the spread of COVID-19. And I do just want to acknowledge the frustration and challenges and sacrifices that people are making today in New Brunswick. For a population of 750,000 plus people to only have 500 plus cases compared to other provinces like Manitoba, Alberta, Saskatchewan, British Columbia, Ontario, and Quebec, they're living a very different reality right now with respect to COVID-19 than we are. And I'm so grateful to live here in New Brunswick at this time. My heart goes out to the other provinces who are not having the kind of success that we are having. And what we've achieved so far has been a collective effort, but to maintain that success, it will continue to be a collective effort along with frustration, sacrifices, and hard work. Public Health has advised against non-essential travel this holiday season, but if you do decide to travel, be aware the case counts in other jurisdictions are much, much higher than here in New Brunswick, which means that if you do travel and you come back, you will have to self-isolate, and the risk of you bringing COVID-19 with you when you return is higher. So helpful hints if you are going to travel. Wear a mask at all times, follow physical distancing rules, especially in airports and other indoor locations. Travel only with the members of your immediate household. Don't travel at peak hours and avoid layovers whenever possible. Don't plan long car trips with multiple stops, and download the COVID-19 alert app to your phone. Santé publique a déconseillé les voyages non essentiels pendant les temps de fête.
Please do not go on travels during this period, and so other areas are in very much more danger than we are here in New Brunswick, and it's really important that we follow all the rules and recommendations. If you decide that you want to travel, here are a few tips for you. Wear a mask at all time, and respect physical distancing in all airports and all groupings inside. And if you have to work, if you have to travel, with your do so with your members of your immediate family, and do not make long trips in a vehicle. And just download the COVID-19 alert app on your phone.
Not have contact with others during this time, including members of their family. If the visit is shorter than 14 days, then the whole time must be spent in isolation. And ideally, those who are self-isolating would be in an environment with access to a separate bathroom from others, like in a hotel. And obviously, the ideal situation is to isolate in a separate location. However, I understand that staying in a hotel for 14 days is not possible for everyone, or you may not have access to a home with more than one toilet. In those cases, it is even more important to follow public health guidance. Each time the bathroom is used, clean high-touch surfaces like taps, light switches, door handles, and practice good hand hygiene. There are more guidelines on our website, and I encourage anyone who has questions to visit the self-isolation page on our coronavirus website. You should not be choosing to self-isolate when an arriving family member as this introduces some risk, so only do so if full isolation is not possible. And I know this season has, in the past, been a time to gather and share meals and songs and stories. But this year, I urge anyone who must self-isolate to think about where it would be best to do that. Think of the members of your family that you could make sick. Think about the community that you may infect. And think about the healthcare system in New Brunswick that is handling the current needs, but could become overwhelmed by rapid case increases. We must do these things to keep COVID-19 at bay, because the alternative is more sickness and hardship in the new year. And I know it is difficult, but it is necessary. And I'm not suggesting that we skip the holidays this year. I challenge everyone to embrace and celebrate the holiday season in new and unique ways. We can't make merry as we've done in other years, but we can still make memories. Organize a Zoom house party. Invite your friends to celebrate with you virtually. Pick up the phone and call someone you haven't talked to in years. Sortez dehors, faire de l'exercice et prendre de l'air.
Go out and try new sports activities or exercise. Above all, look after yourselves and look after others. And without COVID-19, holiday season can be a sad and lonely time for many people. Show kindness and compassion for everyone around you.
A long way in reducing your stress and raising spirits for all. The joy of the holiday season is ours for the taking, and I urge all New Brunswickers to have a happy, fulfilling, and safe holiday season. Merci. Thank you.
Bonjour, good afternoon. Before we begin today, I'd like to say that my thoughts are with everyone who has been affected by the heavy rainfall over the last few days. Our Provincial Emergency Measures Organization has been working closely with municipal EMOs to coordinate their response to this storm. Merci au service d'urgence.
Thank you to the emergency services who have helped the people in need and want to make sure that everybody is not seriously injured. I'm thankful for the unbelievable community spirit that the people of New Brunswick and the volunteers have shown.
We don't have a complete picture yet. We know there has been severe damage in the Sussex and Sussex Corner areas. At least 30 households have received accommodation and support from the Red Cross. A healthy and safe inspection team is in the Sussex area to evaluate homes and businesses once they are safe to enter. And New Brunswickers must register to get a free inspection. You can register and support damages by calling 1-888-292-8555 or online at snb.ca/EMO. In recent days, we have seen decreased numbers of cases of COVID-19 in our province. 3 zones, however, remain in the orange level, and New Brunswick have clearly taken very seriously this situation. We need to keep up that good work in the days and weeks ahead so the whole province can return to yellow, into the yellow level as soon as possible. In speaking with public health, they continue to reassess the situation. And we're all hopeful that we can turn soon to the yellow zone. And these discussions, when the time is right, and hopefully sooner than later, we will be able to meet with COVID Cabinet and Cabinet Committee to make a final decision. But this all depends on how successful we continue to be in our diligence to protect one another and ourselves. I am hopeful that the Zone 1, the Moncton region, and Zone 3, the Fredericton region, will soon be able to go back to level. I know at this time, St. John region, Zone 2 is a bit behind because of the significance of the pandemic, but we're all hopeful that, we can see changes in the coming days. It may take a bit longer in some cases I mentioned in the St. John, but we know how we got there. We know why we've been in this situation for the last couple of weeks. Let's not repeat that. Dr. Russell spoke of the opportunity and us to have a different Christmas. But we'd much prefer to have a yellow Christmas than an orange or a red one. I know that the opportunity exists for us, unlike it exists in other provinces as we've seen. We can get back to the norm in COVID. We know that vaccines are just around the corner. So we just have to be diligent. So let's prepare for Christmas, but let's not get impatient. Let's make sure that we can get back to yellow. Les agents d'application de la loi.
The law enforcement agencies are overseeing the businesses and public spaces on a regular basis and give advice on the best way to protect the people of New Brunswick against COVID-19.
During recent inspections, enforcement officers reported that 98% of the people they observed were wearing masks. I know this surveillance has been challenging for all of us. We got complacent, and that's why we ended up in the orange zones over this past several weeks. We do not want to get complacent again. And I know, although it's frustrating, it's a small price to pay for us to get back into yellow, to once again be back to enjoy our families, but do it in a COVID respectful way, in reinforcing and following public health recommendations. I am convinced we can be there sooner than later. So although I've got complaints too about our enforcement mechanisms, our enforcement officials, I just want you to put yourself in their shoes. They are going around the province, they're taking directly some of the abuse, which isn't always helpful, but they're just trying to do their job. They're just trying to let every one of us understand how important it is and what the role that each one of us play in ensuring that we can get back and get through this safely. We don't want to lose it now. We've received a number of questions about the need for a one household bubble in the orange level, and I'd like to address those concerns. Nous comprenons que les règles concernant le bulle formée.
We understand the rule concerning the one household bubble, but it was a step that was necessary because there were cases related to people that were meeting in households without wearing the mask and without respecting physical distancing. The businesses are authorized to remain open only because of restrictions that are in place, like physical distancing and mask wearing.
Because while we have not seen significant community spread through businesses and public spaces, we have seen a number of cases originating from close contacts who were spending long periods of time together. Nous savons qu'un vaccin sera disponible.
We know that a vaccination will be available soon. We are preparing a plan for the vaccine to be distributed to the people of New Brunswick in the most efficient possible manner, all the while ensuring a balance between the repercussions on health, the society, and the economy.
Time a vaccine is approved federally, we will have a plan in place to deliver it as efficiently as possible, taking safety, security, and resiliency into account. I am pleased to announce that Greg McCullum, the Director of New Brunswick Emergency Measures Organization, will take the lead on this plan. He has experience and the expertise to ensure we deliver the vaccine to the highest priority groups, such as the elderly, people living in long-term care homes, and frontline healthcare workers, and to do it as soon as possible. The vaccine plan will help us set priorities for vaccinations while balancing health, society, and economic impacts. The plan will establish supply chains and logistics. We will create a delivery system that meets New Brunswick's needs. I'm excited about seeing the finish line, and I'm sure many of you are. I'm not excited to the fact that my family can't come home and visit this Christmas as well. And believe me, I've heard it more than once from my wife, Marcia. So we have 3 grandchildren in Guelph. We have 2 daughters, but obviously the daughter in Guelph and her husband, and the 3 grandchildren, and a daughter and her husband in Saskatchewan, neither who will be coming home for Christmas. My mother is going to celebrate 100th birthday, and will likely, a lot of that will be online celebrations for many of my family members. So I'm hoping to get back in yellow as well, so we can have some resemblance of family getting together. So every one of us will play a role in just how much of Christmas we'll enjoy together amongst our collective family members. But it's urgent right now that we don't lose focus. We don't become complacent. Does that mean you can't go out and shop and be excited about Christmas and put up your Christmas tree and be ready to celebrate when we turn to yellow? No, it doesn't. Does it mean that we should just wait for a vaccine and not try to live with COVID the way we have been under the rules of public health? No, we shouldn't just sit and wait. Let's make the most out of a Christmas with COVID. It's going to be a unique time in history. We're all going to look back on this time that we shared together in New Brunswick. We're going to look back and say, wow, I was there in 2020. I was there doing my part. And New Brunswick was one of the best performing provinces in the entire nation because I did my part. And I worked with people that were in the healthcare field, whether it be public health, in the enforcement field, and I worked with my neighbors, and I protected myself and each other. Together, we won't not only beat COVID, we'll be ready for the vaccines when they come, and they're just around the corner. So let's have a Christmas season like we've never had before, because that's where we are right now. But let's have one that we look back with fond memories, memories that could only be created during a pandemic and at a time in our history like we have never seen in the past. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre.
Thank you very much, Mr. Premier.
Beaucoup, Dr. Russell. Nous allons maintenant procéder aux questions.
We are now going to the media questions. You can ask the question in the language of your choice, and please make sure you put your microphone on every time you ask a question.
Questions from the members of the media. Each reporter will have 1 question. Please ensure your microphones are placed on mute, and you have the right to pose your question in the language of your choice. Silas Brown, Global TV.
Thanks, Bruce. This is for Premier Higgs. We've seen recently that opposition parties and advocates have been calling for an eviction freeze and, in some cases, some form of rent control to prevent people from being unhoused at a time when people are being asked to stay home as much as possible. It's something that Nova Scotia has recently done through the emergency order, and I'm curious about what your feelings are on the need or lack of need for an eviction freeze and potentially rent control.
Well, certainly as with any situation or reaction thereto, I always like to understand the facts and the rationale behind it. And I know there's lots of, we can always have a case or a one-off case or situation that may be reflective of a general situation or may not. But in relation to, the cases of evictions, if we actually look at the statistics for 2020, they're currently lower than in previous years. So this is of 10 months, and we're certainly running now at 22 on the 10-month cycle. It could be a few more, we'll look at that over the end of the year. 2019 had a total of 25. These are a percentage evicted. There's different categories here. So if I look at the total requested, I guess is the most simple way to put it. In 2018, there were 1,688. 2019, 2,518. And to date, in 2020, it's 1,525. So we're monitoring that to see what is real. We've been talking with landlords to understand, what has been the rent situation, what has been the evictions. And so we're analyzing right now the stats, and we'll decide how to react based on what the situation really is. We know that there are new buildings going up. We know that there are renovations going on in apartments, but we're being told by the landlords that the general rent rates are that the rental rate increases are low. Anyway, we will pursue to understand that before we react on a policy that may have been necessary somewhere else and may or may not be necessary here.
Thank you, Premier. Thank you, Mr. Brown. Laura Lyle, CTV.
Sorry, no follow-ups today?
Thank you, Bruce. This question is for Premier Higgs. Premier Higgs, can you tell us how many tickets have been issued by enforcement officers for non-compliance in the last, say, 2 weeks or so, or since we entered the orange phase?
Yeah, yes, I can, actually. In the total number, if we looked at between, let's say, November 20th and 28th, there were a total of 2,500 sites that were actually visited. A total of 87 tickets were issued related to non-masking. 45 in Zone 1, 40 in Zone 2, 2 in Zone 3. A total of 38 tickets were related to businesses for other COVID-related matters. There were 17 of those in Zone 1, 21 in Zone 2, and none in Zone 3. So, I was very supportive of our surveillance of following the rules. And I certainly, as I said a little earlier, I certainly commended our officers for their diligence. And I know it can be disrupted, but I'm asking for patience here because we are right on the cusp of the end phase. When Dr. Russell talks about the other provinces, you just got to look around us. So the fact that we have over 1,000 people contacted and in isolation or self-monitoring, maybe more like 1,500, there's still those cases, but they're contacted. At least we know. The ones that we're seeing coming through are either travel or we know. We had a bit of a community issue in Moncton. But the idea right now is that we have this, public health has this, our enforcement people have this, our healthcare workers in general have this under control. So let's not lose it. And I know it's annoying. I know let's use our common sense in how we manage and with the public health rules, because wearing a mask is a small price to pay to ensure that we are able to take a vaccine and do it in a yellow phase and then go directly into green.
Thank you, Premier. Thank you, Ms. Lau. My apologies. I did say in French that it was one question per reporter today. I apologize for that. So it is one question. Jean-Philippe Hugues, Radio-Canada.
Yes. My question is for Premier Higgs and Dr. Russell. Is it a scenario that for which New Brunswick must prepare if Zone 2 or 3 remain in orange? All of the information we've just put on the website as to what is allowed for Christmas celebrations. Each phase is written down. The guide tells us that in phase yellow, with physical distancing, 50% will be allowed outside or less, and inside it would be 20 people, up to 20 people if it was a yellow level. But we're really concerned that if it could cause some outbreaks after the holiday season, and we should follow those rules. And I was talking about orange. Well, I hope we're not in the orange zone. We can't prevent that at this time, but that information is also at all levels, all orange levels. It's really only one household bubble. And if it's something you want to do outside, you plan an outside activity with physical distancing with 10 people.
Premier Higgs, you said our complacency led us back into the orange zone. Looking back on it now, do you think there should have been tougher enforcement earlier to prevent this from happening? Do you think you sent a strong enough message to New Brunswickers, before all this happened?
Well, we can always look back in the mirror and say, if we could we or should we have done anything differently. The whole process from the beginning has been somewhat of a balancing act. And I think what we're seeing right now is people are COVID weary. They're tired of being in a pandemic. We're seeing it in other cities and other provinces and in the U.S., where people are just outright rebelling and saying, I've had enough of this. So there's always the balance. And here we are right now where, we could be doing the 100-yard sprint, and we're at the 90-yard point, and we're saying, I've had enough of this. I'm tired of running, so I'm just going to stop. So we're trying to balance it and say, look, we're trying to keep the economy moving. We're trying to allow people to do what they do every day, just with a little different format of how they protect themselves and each other. And I think the results have shown a very effective process that's been a culmination of many efforts by many people, as I've often said. So, if we could have, would have, should have done something differently, well, look around us. We've done quite well. And I want to be able to continue that. But this isn't a singular effort. This is a combined effort. And we need to all be in it together to the finish line. And the finish line is right in front of us.
Thank you, Mr. Waugh. Thank you, Premier Vicky Hogar, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, if I heard correctly, Zone 1 and 3 are being reassessed to return to yellow on Sunday. I'm just wondering, what criteria are you looking for Zone 2 to meet to qualify to be reassessed to return to the yellow phase of recovery? And are we still seeing cases this week that are related to the super spreader event?
Well, the only reason we weren't planning to reassess Zone 2 is just because we did have a conversation today about Zone 2 and following very closely the situation at the Shanix. And so we still have some more testing to do in the next several days. So again, we wouldn't be ready to reevaluate just yet. But certainly for Zone 1 and Zone 3, our risk assessments are always based on the triggers, but they do take into account other factors. But the main triggers that inform our discussion and inform our decisions are the triggers document. So again, what got us to orange, we monitor whether all of the measures that we've put into place thus far are working. Are we seeing transmission after the measures were put in place? Because in the Zone 5 outbreak, after that 2 weeks that first 2 weeks in orange, we reassessed and saw that there was still transmission occurring in that all of the factors that were driving the transmission hadn't quite been addressed at that time, and we needed to do more to get the outbreak under control, which included more messaging, more education, more inspections, and really limiting people's close contacts. So in every situation, it's different, and but Sunday we will reevaluate Zone 1 and Zone 3.
Thank you, Ms. Hogarth. Pascal Rochenotte, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour...
Yes, my question is for Dr. Russell. The Department of Education announced today that the COVID in the Christmas break will not be extended. And he says that it's not necessary, it wouldn't help in abating the spreading of the COVID. Would an extension of the Christmas break should have been put in, or no? For the people who go to school here in New Brunswick from kindergarten to grade 12 are within the province, and individuals come back from a trip, they will have to self-isolate for 14 days. And I know that schools, universities, and colleges, there are people that had additional weeks to make sure that they can do their self-isolation because of their trip. But with the schools here in New Brunswick as such, I'm sorry, I can't finish my sentence. The change of the Christmas break for the schools up to grade 12, it was not necessarily, because if it was an outbreak at that time, it would have been done on an individual basis at the school level.
Telegraph Journal.
Hi there. My question is for Dr. Russell. In the provincial guidance for long-term care homes in an outbreak, it says temperature checks have to be done when workers or visitors are coming in. I'm wondering if rapid tests are being used in that situation, either with or in place of the temperature checks. And if not, could you just elaborate on the situations where rapid testing is being used? Because the guidance on testing I'm able to find doesn't actually make any mention of rapid testing. So if you could just elaborate on that, that'd be great. Thanks.
Great question. So you're right, for visitors, et cetera, and staff, that they're not provided with rapid tests unless it's assessed by the medical officer of health who's in charge of the outbreak, that determines that. And that's usually done in a setting where they need the information very quickly, just because if the person was at risk of having many, many close contacts that either need to be isolated or cohorted, whether that be staff or patient or clients or residents, then that would be the case that it would happen. I believe the only other case that it was happening is when there was a bit of a backlog. Then I think in one of those situations, the medical officer would have used it for that reason. But for the most part, it's higher risk at the beginning of the outbreak to make sure they're not missing anybody in that first round of testing. Because once they do the first round of testing, they do the isolating, the cohorting, et cetera, making sure which staff people are isolating and who are test positive, then they will then after that go every second or third day and do the regular PCR test after that.
Thank you, Ms. David Coach, Times and Transcript.
Hi, for Dr. Russell, senior officials at both Vitalité and Horizon have described a healthcare system that was already overstretched, now further strained by the pandemic. Where has the pandemic taken the greatest toll in the healthcare system, and what resources are being deployed to address it?
Well, that's probably a better question for Vitalité and Horizon. I can say that my contact with the with Vitalite and Horizon have been through planning for outbreaks, et cetera, whether it's with long-term care facilities and social development, whether it's the effect on hospitals directly related to COVID with respect to capacity. I know that during the red phase, the initial wave of COVID-19, that the exercise of emptying the hospitals, making sure that ALC beds were freed up to really assess the capacity of how many beds, how many ICU beds, and how many ventilators. That was a great exercise to have done. But what we learned from that exercise after the fact was that all of the delays of surgeries and other types of services that had put on hold created a backlog of trying to catch up to those services. And so moving forward, what we knew we needed to do, separate from outbreaks of COVID, was manage the capacity of each hospital in all the zones, so that at any point in time, if there had been a surge in COVID cases, that they would have that capacity in the ICU, they would have that capacity in the hospital. You are right that prior to the pandemic, that my understanding is health resources were an issue, but that's not new, and we've certainly taken that into account in all of the managing and all of the planning that we've been doing. So you will see that, keeping the highest level of inpatients and services that we can, while balancing that with the need to be able to adjust to surges in communities is really important. And that's monitored very, very closely by both RHAs when there's outbreaks and even when there aren't outbreaks. But certainly the collaboration through the Pandemic Task Force and through the leadership of both Horizon and Vitalite has been key to being able to keep everything afloat and keeping all of those things going and being very judicious about the resources that we do have.
Thank you, Mr. Coach. Thank you, Dr. Marie Sutherland, CBC.
Hi, my question's for Dr. Russell. CUPE says some kind of administrative leave pay is needed for healthcare workers when they're asked to self-isolate, or if they start to experience symptoms and are faced with the choice of either hiding their symptoms and going to work, or reporting their symptoms and staying home with no pay. I'm wondering, is this something the government will consider or is considering, and if not, why not?
I don't have a specific answer for you. I am aware that in a general sense there are some situations, not necessarily with healthcare workers, but other settings as well, where it is difficult for people to self-isolate and stay home when they're ill. And so I agree that that is a challenge. And my understanding is there probably have been discussions on that topic. I don't have an answer for you today, but I can get back to you with that.
Thank you, Ms. Sutherland. François Leblanc, Radio-Canada.
Yes, Dr. Russell. I was just wondering if there's a plan of a bubble like the NHL or other sports. I was not part of the conversation with those members. Maybe the Premier could answer. If no, he can't answer neither. For now, it's not something that will change. It's a good question. It's something we can come back to in a couple of weeks or a month.
So yesterday, the Center for Disease Control in the U.S. said some 2-week COVID quarantines can be cut from 14 to 10 or even 7 days. A 10-day COVID quarantine period is listed on Public Health Canada's website as a potential option. Is there any discussion about cutting the isolation period down from 14 days in New Brunswick? And if no, why not?
Well, we did read that piece of information, and my team is studying it right now. It's not a new concept. That concept has been discussed several times in several different venues throughout the course of the pandemic. Thus far in Canada and in New Brunswick, we haven't really felt confident that we could reduce that. Other jurisdictions have. Even within Canada, but we are really going the extra mile in terms of being as safe and secure as we possibly can, because it is a numbers game. It is a 14-day self-isolation, And yes, you could be quite confident to catch the majority of people by the day 10 timeline, and we do day 10 testing, and we do find cases turning up positive at the day 10 of their self-isolation. But there still are some people who come back positive on day 12 and later. So again, we are erring on the side of caution at this point. We are going to review that information again with the public health team, but I don't see a move to making any changes at this point in time. We are trying with our testing strategy around workers who travel in and out of the province to try to make that as safe as possible as well with the testing regime. So it's not something that we are not, it's not something that's new in terms of the idea, and we can certainly revisit it as the pandemic has been an ongoing issue in terms of learning opportunities and taking those learnings and applying them. We were always open for new information and analyzing it.
Thank you, Mr. Haggard. Thank you, Dr. Harry Forrestal, CBC.
Thank you, Bruce. This question is for the Premier. Premier, I'd like to take it back to an earlier subject for just a moment. You said some time ago that you had asked landlords to refrain from rent increases aimed at emptying properties for the purposes of renovation or other uses. CBC has carried a number of stories of tenants whose rent has been increased by 30%, up to 50% or more. What indication have you had that landlords have acquiesced in any way to your request earlier? And given the public health appeals we're hearing every day to reduce contacts, is this the environment you want people forced out of homes to find new accommodation?
Well, Harry, as I said earlier, the stats that we've seen would suggest that the eviction rates during the pandemic have been very low. So we've asked for details on that, but looking at the overall stats, they're less than previous years. So I know you as your report, you have some particular cases, but I've asked for an evaluation from, and I've asked on the landlords as well, their association, to give me details on rent increases and evictions particularly, so I have a very clear understanding if it's an issue or not. Because I expect landlords to do the right thing during the pandemic, and that would be that you wouldn't be, making it unreasonable. You wouldn't be doing things that are totally untoward or things you could have options to do differently, and put someone out in a pandemic. So I will have that information from the landlords so I can assess it directly.
Thank you, Mr. Forrestal. Erica Butler, CHMA, Sackville.
Hi there. This is a question for Premier Higgs, and it's about enforcement. I'm not sure if the numbers that you quoted today include tickets issued by public safety officers as well as those issued by police officers. But I guess what I'm actually really wondering is if you have given direction to those public safety officers and police officers as to when to hand out compliance orders versus when to hand out tickets for non-compliance. I'm thinking in terms of local businesses. So the idea being, should they be first handing out a warning to tell people how to comply and make sure they're complying and give them a deadline, or should they just be hitting them with a ticket? Or, can you imagine a scenario where it would be appropriate to give them both of those at once?
Well, firstly, this includes all enforcement. So the numbers that I gave the statistics on were based on the enforcement of any particular group, and it was during the orange phase of these latest 3 zones. So, but if you look at the ratio of our total number of like 2,500 sites, and that there were actual visits have been conducted, and we have a total of 87 tickets. If you look at businesses, a total of 38 were included in that. So out of 2,500, we've had a total of like 140 or 120 actually tickets out of 2,500 visits. So in that sense, it's like I certainly didn't give any instruction related to specific infractions, but what we have asked our safety officers to do was look at the rules that we have, particularly under Zone Orange, and ensure that the rules are being followed. And, that's something that, whether it be a police officer, or safety official, safety officer, or public safety, it's what they do every day. So they're well-trained to be looking at infractions to the rules. And all our instruction would be is that we have emergency order rules that we need to follow in order to ensure that the individuals are protected and that we can ensure that the pandemic does not get out of control. And, I'm pleased to say thus far, that's the situation we're in. The pandemic is not out of control, and people are being protected because everyone's doing their job. So I certainly don't fault them for doing their job.
Thank you, Ms. Butler. Thank you, Premier. Marie-Ève Arsenault, Radio-Canada.
Oui, bonjour. Ma question est pour le...
Yes, my question is for Premier Higgs. People who want to come into New Brunswick, do they have to... What guarantee do you give to people who want to come into New Brunswick to visit a close family member will not be refused at the border?
Well, I think we have a situation where everyone is asked to register who needs to come, and we have even in the current levels of orange, there are for compassionate reasons that are identified in the orders. So if they're registered, they will have they will already be known to be traveling, and they will be recognized as such when they arrive at the border, and they will be allowed passage, and that passage will be identified what it is. So I think that system is well set up. It was well set up before in any level, but it's even more routine now because we've been at it for a while.
Merci, Marie-Ève. Geneviève Normand, Radio-Canada.
Yes, my question is for Premier as well. I was wondering, Premier, if a location has been determined with regards to where the vaccine will be administered in New Brunswick. And also on that topic, I was wondering how, do you feel that you're getting all the information needed at this point from Ottawa?
So firstly, in relation to where it'll be located, as I mentioned, Greg McCollum, our Director of Emergency Measures Organization, is coordinating the activity with us, working with the federal officials, working with the military, as we lay out the requirements for logistics. However, before we can do any of that, we need to know exactly the quantities that we'd be receiving and when. And that is unknown, so I don't know that. I do have another call tonight with my colleagues, and maybe more information will be provided. We did hear some indication of some trial run being done in December. However, any communication that I've had with the PM and my colleagues across the country, it's been related to rollout in between January and March. We would be identified with how many samples, how many vaccines we'd actually be receiving. At this time, we think it's somewhere in the order of 60,000 on a per capita basis, but that has not been confirmed. The exact dates have not been confirmed. I do have a call tonight and another call tomorrow with Minister LeBlanc. So I'm confident we'll get the information and we'll be able to work through the logistics of delivery. I feel equally confident about that.
Merci, Mademoiselle Normand. François-Pierre Dufault, Radio-Canada.
For Premier Higgs as well. Nova Scotia is reporting 11 cases today. 2 of them are in the northern part of the province, which means that the outbreaks that we've seen in the Halifax region, some of it might be moving north closer to the New Brunswick border. So just wondering if you have any plans to tighten the controls at the New Brunswick-Nova Scotia border and the one with PEI as well, and if you have any plans of tightening them even further in the lead up to the Christmas holidays when people will likely be traveling between all maritime provinces.
I will just answer the part that involves public health, and then I'll turn it back over to the Premier. We do risk assessments of the Nova Scotia situation regularly, And the last conversation we had did not indicate that we were going to need any extra border measures at that time, but we will continually reassess that, because it's not just about the risks themselves in terms of community transmission, which we are very concerned about. And we don't want to see that pop up here in New Brunswick, but we know it is possible. We have seen some community transmission related cases in the Zone 2, Zone 1. And again, we're on the lookout for that, and certainly the measures that we put in place around non-essential travel to Nova Scotia at this point in time, and anybody who's coming back from Nova Scotia has to self-isolate for 14 days at this point in time unless they're working. They're working.
Yes, I don't have much to add to that, obviously, because we'll work with public health to understand the risk. But at this point, having all requirements of a 14-day isolation for anyone coming back into New Brunswick. And I know it's on the honor system. I know we don't have a border control set up, and it's not our intent to do that at this time. It's hopeful that we will not be able to get to that situation. However, we put back the 14-day isolation for anyone that was coming into the province, and with the caveats around essential services. And if we have to go further, we will.
Merci, Monsieur Premier Ministre. Isabelle Leger, CBC.
Hi, my question is for Dr. Russell. Would there be any reason why a university student might be denied a trip home if they're moving between health zones within New Brunswick? And are students from Halifax able to come home for Christmas break?
Well, anybody traveling for non-essential reasons has to self-isolate for 14 days, regardless of who they are. And so there's that. What was the other part of your question, sorry?
Within New Brunswick, if a university student was wanting to come home for Christmas and they're within New Brunswick but traveling to a different health zone, so say it's like a student in Fredericton, for example, going to St. Thomas, wanting to travel to Moncton to see their family for Christmas, would they need to self-isolate or would they be denied going there at all?
Well, we're not enforcing the non-essential travel recommendation. We're strongly urging people to not travel for non-essential reasons. Obviously, right now, between the 3 zones that are in orange, we would not want people traveling between those zones. We wouldn't want people traveling in and out of those zones other than for essential reasons. So, but there would be nobody enforcing you to stay in a particular zone. It's a strong recommendation that we urge everyone to adhere to, because that's how we're going to keep these outbreaks going in the right direction so we can all get to the yellow phase before Christmas.
Thank you, Doctor. Thank you, Ms. Leger. Before we terminate, I just want to point out a clarification. A telephone number was read earlier. The correct number is 1-888-298-8555. Un point de clarification, le numéro qui était...
A point of clarification, the phone number that was given earlier is 1-888-298-8555.
Home, the correct number is 1-888-298-8555. Just un point de clarification.
Just a point of clarification for the toll-free number, 888-298-8555.
C'est là que termine la séance d'aujourd'hui. Merci beaucoup.
This concludes today's session. Thank you.